today with quite an extraordinary fella who shares some of my passions, although he's a little bit more capable than I am. He has a background that is just terrific. I want to introduce everybody to my friend, Dr. Anthony Chang. A little quick run on his background, because his background tees him up for the conversation, but I want to drill down really on what I think will be a very exciting talk. Dr. Chang from Georgetown University received his medical degree. His specialization is pediatric cardiology. And if that was all he did, that would be very vital, because there are so many issues right now in pediatric ECUs and so much to talk about. But beyond that, Dr. Chang, among his many accomplishments, I mean, MD, MS, MA, all of this stuff, he is a specialist in biotech data, thanks to time spent at Stanford University. And his dual passion is AI. For the last 15 years, he's been working his magic at Children's Hospital of Orange County. And that has involved work in clinic. He is the chief intelligence officer there. And he just has such a storied workup. But I think if we have to gauge who it is we're talking with, we're talking to a transformative MD who is continually updating not only himself, but the rest of us on transformation in medicine. And with that, Anthony, tell us a little bit first about, we'll take baby steps first. Tell me a little bit about pediatric cardiology, how you are involved, and are you practicing? Are you into other things? Let's first start there.
Well, thank you very much, Mike, for the kind words. Yes, I'm still practicing. As a matter of fact, I just got done with about 13 kids this morning's clinic. So fresh from practicing. And it's just a joy, because I'm back in the clinic now after about a year of telehealth. And as much as I think that's really been able to, for me to maintain contact and surveillance of my patients, we really do miss each other in reality. So I'm grateful that I'm back. Obviously, we're being extra careful given the recent developments with the Delta variant. But so fortunately, not too many kids in my clinic have contracted COVID, but there is definitely a fair number. And we're just going to have to track them, because some of the, I think, effects of COVID on children, particularly with their hearts and lungs, is going to be longer term, unfortunately, just like you see in adults.
Yeah, and there's such true innocence, you know. I mean, I know your two daughters, and they're just two gems, and so you can imagine how parents and people all over the world must be feeling. With regard to pediatric cardiology, are you enlisting at the current time new versions of AI to be enabling? And can you, if the answer is yes, can you tell us a little bit about it? And also, can you tell us, are you monitoring it not only in the United States, but in other countries where you may be seeing successes?
Sure. There's several areas where deploying AI in pediatric cardiology of immediate relevance is deploying AI to look at the data for short and midterm effects of COVID in pediatric patients, and particularly with their heart conditions. So that's a project that's ongoing. we have access to a few hundred hospitals, not all of them pediatric hospitals, obviously, but a few hundred hospitals. So that's going to be a very worthwhile project, and we're planning on publishing the results soon. Another area that we're trying to deploy artificial intelligence is leapfrogging into the future, trying to figure out how to share data. I think one of the biggest limitations in the last year and a half with AI has been the inability for all the health systems to be able to share data. It definitely came out of nowhere. So we were just starting to have activity in the area of hospitals sharing data, but nowhere close to getting there. And I think this pandemic has demonstrated once again how important it is for our health systems to share data. And as you said, not just in the US, but around the world. So everyone is a little hesitant to share data, understandably. So one of the projects I'm working on with our team is the concept of swarm learning, which is if you understand how bees and fish and ants behave, everyone sort of pulls your weight, and there's oftentimes no central leader, and yet they perform beautifully and learn from each other. So the concept of swarm learning I'm particularly excited about, because I think that's going to be the final sort of hurdle we need to jump over to convince at least children's hospitals to share their data, be it electronic records or images. I think it's going to be achievable by the end of the decade with the combination of blockchain and swarm learning and Internet of Things. I think those are all technologies that can be bundled together and enable us to finally learn from each other without sharing data. So while sharing data is a very noble way to gain insight into medicine, but I think we can actually have a better solution.
It's so interesting, something you said at Stanford that I just kind of blew me away. You spoke about 10 years of trying to aggregate data the old-fashioned way, followed by, what was it, 1 hour or 1 day? I can't remember which one it was, with the use of AI.
Yeah.
So the barn doors are open, the horses are charging out, and now all this has to be harnessed for some good.
Yeah, that's exactly right. Just having abundant data doesn't mean you have insight. So I think there are two major issues with AI right now. One is not having access to accurate and abundant data and sharing that data and the insights from the data. And then also the second problem is that when one healthcare system is deploying a model or an AI tool, it's not been shown that it can generalize to another health system. So we need to be able to share data and insights, and also whatever model we build ought to be able to be universal, right? I mean, if you gain insights from a hospital in California, but you can't generalize it or use it in another country like the UK or Japan, then it's only going to be limited to that hospital in California. So we like this to be as generalizable as possible, and that people share insights based on their data. But I think I'm very cautiously optimistic that we can overcome these hurdles in the next few years.
Let me have you comment on another component. And once again, this is sort of trailing from my my talk at Stanford. I touched on the new paradigm of B to C to B. And what I mentioned was, number one access thing on the web is porn. Number two access thing on the web is health. And now regular consumers, not medical people necessarily, want to be part of a very important conversation, and in fact, insist on it, Anthony. So my question for you is, I know there are a lot of clinicians watching, There are also a number of people who are just interested in meeting you, learning what you're doing, and saying at the tip of their tongue, what's in it for me? What do I need to understand this? I wrote the kidney dialysis protocol for Amgen many years ago, and they brought me in to meet with Amgen scientists, and you could understand them, I couldn't. So I had to dumb down everything they said into language first an MD could understand, second a nurse practitioner could understand, and then I was able to go to HCFA with the language for the for the manual. All it was let's lower blood, or let's raise blood hematocrit level to 31, and let's help kids with anemia. So there is a conversation to be had with the consumer right now, and it in some ways will drive the funding, will drive the train. They will ask about it. They will want to know, what is it? You don't have to tell me specific details, but I want to know, where are we going in the next 5 years, the next 10 years, what it is you're thinking. We'll make the assumption, we believe you because you've done everything else in your life and you're going to do this, okay? And you're one of a select few people who can do it. So that's putting it on you, Anthony. But those two little girls are going to want, before they become doctors and astronauts, they're going to ask some questions to try to get their head on straight about what's happening. What do you want to tell consumers about where we're going with this melding of AI? I do know that there would be a lot of people, when you were talking and you had them raise your hands about an autonomous car and an autonomous plane, there's reticence to get involved with it unless you know a little bit more. So what can you tell them? You're the guy.
Okay. Well, I do find it interesting, Michael, that the number of people that raise their hands for both autonomous driven vehicles and autonomous flying vehicles are increasing by the year, and substantially. And also, do you remember the third question was how many people would accept an autonomous interpretation of their CAT scan?
Yeah,
and I think that number has gone up also. So I think it's a matter of trust. And I think clinicians are starting to trust it more. They see it in action. They see some tools being deployed. They like to understand it more, and they sometimes hide behind the concept that AI is like a black box and they don't understand it. So therefore, maybe they can't trust it or shouldn't trust it. When in fact, a lot of clinicians work with tools that they really don't understand. For myself, a pacemaker, for instance, I couldn't tell you the engineering aspects of the pacemaker, but I just had a patient that received a pacemaker today, and I will be trusting it to make sure it works. So I think what clinicians need, Michael, is a tool that they don't necessarily understand all the nuances inside that tool, but they can trust it enough to know that it's predictable and that it'll give them the answers they need, and maybe even insights when it gets really good. And I think we're slowly getting there, but it's going to take clinicians to really take some time and what I call become conversational with AI rather than just say that it's not something they'll ever understand. On the consumer side, I think it's going to be an outstanding decade of this medical knowledge that doctors had been holding sometimes to themselves is going to be democratized more and more. If you just look at one of the first direct-to-consumer medical tools is the Google Dermatology Assist tool that will enable anyone to take 3 pictures of a skin lesion, and it will be able to tell you what the likely diagnosis is and a differential diagnosis. So something that a dermatologist can do. Now, there's an upside to downside. An upside is rather than everyone sort of describing what their skin lesion is like and maybe be fairly inaccurate, they can actually get the picture interpreted with a deep learning AI tool. The downside is if the tool doesn't get it quite right, it might give people false reassurance and therefore not timely diagnosis and therapy. But I think overall, we have to look at overall good is going to be I think, better than the downside. And I think it's going to really raise the level of medical knowledge of the general public, and perhaps also young people to go into medicine at a critical time in our lives.
Will this help us enable equity in healthcare, particularly to third world populations, and how?
Well, I think we do have to be careful. We don't want tools like this to be only accessible to people that understand how this will work. But on the other hand, I think by having tools are readily accessible with a cell phone or other tools, that you'll have the entire world be able to have access to medical knowledge. And I, as you know, I came from some very good hospitals during my training and during my career. I always felt like,
yes.
I always felt like, well, what if you're the parent of a child with a medical condition and you don't have the capability or the resources to go to, some of the best children's hospitals around the country or around the world even. And that feeling of inadequacy from the parent must be tremendously heartbreaking. Yeah. So what I've always seen, Michael, is that the medical knowledge from the best centers can be encapsulated and disseminated for everyone, because there are plenty of patients and conditions we don't need to be competing. And rather than the U.S. News and World Report ranking hospitals, I'd rather see them rank diseases that need to be conquered, and that everyone work together.
Bless your heart. That's very good. I'm friends with Dr. Fauci, and many years ago this is pre-COVID. Who thought we'd have COVID for a couple of years? And I think he was working with some group, but he said, the thing I am most thankful for is that when I was a little baby, first thing they did was grab me by my ankles, smack my bottom, get me to breathe. Then I looked out the window. Well, first I looked up, I went, oh, so you're my mother and father. And then they pointed to the window and I looked out, oh, and this is where I live. And then the next thing they did was give me my smallpox and polio vaccination. And I never thanked anybody for that. I think Dr. Spiegel delivered me, but he's long since gone. So thank you, Dr. Spiegel. But I think what's important about that is the work that you're doing to hold this conversation across the world in other populations. I mean, I deal regularly with, because I'm London Speaker Bureau Asia as well. So Singapore, Vietnam, Thailand, Laos, China, all these unique perspectives on what we do about this. But if there's anything to be said good about COVID, number one, COVID is actually quite a bit helped along the acceptance of telemedicine. In the same way as Zoom has created similar opportunities for those of us who are supposed to be on the stage someplace in the world talking. But I think now we have those tools, we have the fine minds to gather this evidence. And I'm so delighted that our viewers are able to get your world perspectives on all of this, because you're an unstoppable force. And give us some parting comments about, given the fact half of our audience is clinician, half of our audience is just inquiring minds. What do you want to leave us with? Where are we going? Can you give us any kind of timetable, or is that too ambitious and not the scientific method? Tell me what we're going to do next. What's going to happen?
Well, I'm already seeing, Michael, a growing number of clinicians with a growing interest and passion for deploying artificial intelligence to help with the many problems that we have in healthcare. And I think it's the equalizer if we allow it to be deployed. in an intelligent way, not just
Yeah.
go with the tools that is popular, but actually learn about the limitations and the capabilities of AI. And it's kind of like a tsunami. If you ever, I've actually seen a tsunami from a distance. It's not the big tidal wave that everyone thinks it's going to be. So just like AI, it's not going to be this big tidal wave, Michael. It's going to be a very fast rising water level over a large area. Thanks to, unfortunately, our COVID overlords, this generation potentially will live anywhere from 1 to 5 years shorter than the previous generations. For a clinician in healthcare, that's very distressing to me. We have to deploy, and it's actually more in the minority groups in terms of decrease in lifespan. If you can imagine, in this country with all the resources, we're going to lose life expectancy for the first time since World War II. So that's very distressing to me as a clinician and a scientist, and I will work my best to help contribute to the overall cause to decrease this possibility. I'm looking at my 2 children, and I really want to leave a situation that's much better than what we have now.
Yeah. And I absolutely agree with you on that. And that is very, very troubling. But you have to get started working on it. You can't just be complacent and allow it. Just same thing with the virus. I mean, the virus is going to keep mutating and mutating and mutating and laughing at us with every new mutation. And so we've got to put up the good fight with the good intelligence, and we will win. And hopefully we'll restore some normalcy, and it will be in great measure thanks to brilliant medical minds like you. And I really appreciate you giving us this time. And let's do it again, okay?
Okay. Well, thank you for the kind words. As I said at the beginning, just a very privileged convener of people that are truly brilliant. But I think anything to move the needle on the situation right now is going to be, I think, extremely rewarding for everyone.
Absolutely agree. And thank you. Thank you so much, Dr. Anthony Chang.
Thank you for having me, Michael.